Many patients with rheumatoid arthritis have eye problems. In this video, we're going to go over which eye problems are most common in those patients and which are most concerning, and what you need to know as a patient who has RA about eye problems. Hi everyone, my name is Dr. Saya Nagori. I'm a board-certified ophthalmologist, and I treat many patients in my practice who have eye issues and also have rheumatoid arthritis. The first eye problem I want to talk about is dry eyes, and it's actually been reported in up to 44% of patients who have rheumatoid arthritis. This is because inflammation affects the tear glands and it can lead to decreased tear production in patients who have RA. Patients may feel a gritty or burning sensation in their eyes. They can have redness, light sensitivity, and dry eyes can also cause blurry vision. Now, unfortunately, severe dryness over a long period of time can actually lead to corneal damage if it's left untreated. So all patients who have RA should check in with their ophthalmologist, especially if they're having symptoms of dry eye. Fortunately, we have many great ways to treat dry eye, so this is definitely something your eye doctor can help you with. The second problem I want to talk to you about is something called episcleritis. Episcleritis is a relatively benign inflammatory condition, and it affects the tissue called the episclera. This is a thin layer of tissue that lies between the conjunctiva and the sclera, which is actually the white part of the eye. When patients get episcleritis, it's typically mild and self-limiting, which means it doesn't lead to other major eye issues. But when patients have episcleritis, it could indicate that there is something else going on in the body. So if a patient comes to me and they have repeated bouts of episcleritis, I will certainly be sending them for further testing to their primary care doctor to check for inflammatory conditions like rheumatoid arthritis. Symptoms of episcleritis are a feeling of mild soreness or grittiness in the eye, and usually there's also redness, but the hallmark of this is that there's really no intense pain. This is in contrast to the third eye problem that I want to talk to you about, and this is scleritis. Scleritis is an inflammation of the sclera, which is the outer white layer of the eye. Scleritis actually causes severe pain, redness, light sensitivity, and unlike episcleritis, scleritis can actually damage the ocular tissues and it can severely affect your vision. But how common is scleritis when it comes to patients who have rheumatoid arthritis? So anytime we see scleritis, about 15% of those cases are attributed to patients who have RA. However, while 44% of patients with RA will get dry eye, only about 2% of patients will actually get scleritis. This means that the vast majority of patients who have RA should not really develop scleritis during their lifetime. The fourth eye problem that can happen to patients who have rheumatoid arthritis is something called uveitis. Thankfully, this is even more or less common and only affects 0.3% of patients who have rheumatoid arthritis. Patients should watch out for a red eye, light sensitivity, and eye pain. In order to diagnose uveitis, the ophthalmologist will need to look at your eye under the slit lamp because we can see small cells that are inside the eye that are not supposed to be there that indicate inflammation. Uveitis is typically treated with steroid eye drops, and this actually leads me to my next problem that is associated with rheumatoid arthritis. So the fifth and sixth problems that are associated with rheumatoid arthritis, but they're really not caused by RA itself, are glaucoma and cataracts, and this is because many rheumatoid arthritis patients are treated with steroids. And being treated with steroids chronically increases your likelihood of getting glaucoma and cataracts. Now, the last problem I want to talk to you about is very rare, but it is important to know about because it can be very devastating. It's called PUK, or peripheral ulcerative keratitis. This is a very serious eye condition, but as I mentioned, it is fortunately very rare. Patients in this disease can have severe eye redness, decreased vision, pain, tearing, light sensitivity as well. The corneal thinning that happens in this condition happens at the periphery of the cornea, and it actually is pretty severe. It can be so severe that it actually could lead to perforation of the cornea. Overall, it's a very rare condition. Only 1 to 3 people per million of people in the population get it. But in those who have it, there is a very high association of them also having rheumatoid arthritis. Fortunately, as I mentioned, it's not a common problem. It's important for all patients with rheumatoid arthritis to have an eye doctor that they check in with regularly, and your ophthalmologist should see you every year. Sometimes patients may need to be seen every 6 months, depending on how bad their dry eye is. It's also important that the ophthalmologist is checking for other signs of inflammation inside the eye that could indicate that you're having an issue or an issue that might come up soon. Hope you found this helpful. Please support the channel by hitting like and subscribe below, and I'll see you in the next video.